when working with different creators, oftentimes I hear, well, our legal team will never let us do it because everything has to be scripted and we want it to feel authentic. Of course you do. You should want it to feel authentic. But just because you have to give in your brand guidelines doesn't mean it can't feel authentic.
Welcome back to the MM+M podcast. I'm Lesha Bushak, pharma editor at MM+M. And here with me today is Emily Welker, head of industry health for Inmar Media. And we're going to be talking about how healthcare brands are safely expanding into new media and really what they need to know about how they can move beyond the banner. Emily, thanks so much for joining.
Thank you for having me.
So we've really been seeing healthcare marketers broadening their media mix because they're seeing audience behavior shift. And over the last few years, we've seen HCPs and health consumers really spending a lot more time and attention on social media platforms, streaming platforms, live events and sports. Healthcare marketers have long relied on sort of a familiar traditional set of endemic and performance-driven channels. What would you say is now driving this push into these newer environments?
Well, I think there are several factors driving this. One would be the fact that as our overall consumer behavior is changing, and we're all consumers, right? Whether we're patients or doctors or caregivers, we are all consumers of media. And so as the way that behavior has changed in terms of really shorter form, clips, social, we have to begin to expand the way we look at pharma media as well. And so one thing that I always think about when I'm doing media planning is the fact that, listen, the endemic sites and the endemic contextual type ads are very, very relevant, and they still need to be part of a media plan. But we also need to start expanding beyond that. And we're starting to see that with different sports partnerships. I think of AstraZeneca with the NHL, AbbVie with the MLB. Big partnerships are happening because we know that this is where people are. And we know that it's really important to meet, whether you're a patient or a physician or a caregiver. We need to meet you where you are so that you are constantly being reminded of the fact that whatever brand it is, whatever manufacturer it is, we're here to help improve patient lives.
Yeah, we've definitely been covering the sports push a lot, the sports marketing push in pharma. It's definitely a growing space, and they're seeing positive results from that so far, both in the general sports space and the women's sports space. I think this push into sort of where consumers are outside of the doctor's office is a big thing as part of the sports push. And how should brands think about how they can reach HCPs and health consumers in those moments, sort of like between that white coat and blue jeans moment?
Yeah, absolutely. And that's a lot of like what we're talking about even internally, is really understanding the HCP as a consumer, right? And then that patient is a consumer as well. And so the way I look at it would be to say, you're going to be in these environments. Let's think about who do you want to reach, right? So if you think about sports, if you think about social, if you think about kind of any experiential media, right? You think about who it is you're trying to reach. And then you go to understand, is that person, is that consumer of media going to be in that space, right? So I love the sports angle and the social angle in particular because it transcends a lot of different kind of silos that we have people bucketed into, right? And so, for instance, when we think about collegiate sports, oftentimes we are in situations where we're targeting certain geographic areas for a client. But when you look at sports and when you look at collegiate sports, those transcend the area. So if you went to college at IU, but you now live in New York, it's still very relevant for a client to be looking at targeting around different games, because even that client in New York is going to be reached during that game, right? During that fandom, during that experience. So I really love the way that it extends the reach beyond just a certain geographic area. You're really hitting those very important patients and HCPs that are not just kind of confined, if you will. I also love the idea of the way we're looking at social, right? So social is, in my opinion, one of the best ways to link DTC and HCP together. We look at the HCPs as thought leaders, but we can also look at them in their HCP space of they're communicating information for their patients. What better way to do that than via social creator? Because this is where people are. I read a stat recently that said clinicians spend about, I think it was like 8 minutes on a clinical site and 45 minutes on social. Well, one, that's because our clinicians are younger, but two, that is where they're at. That's where they're getting information. That is where they're changing their behavior, right? So we need to meet them there. And this is where a doctor can also interact with other physicians, but also interact with their patients. And they're going to that. Consumers are going to that. Think of the first thing you do, right? If you find out you or a loved one has anything going on, you probably take to the internet. You may take to social. And what does that do? That allows us to look at what else is going on. What are other people doing? What are other people saying? And it really is a great way to connect the two. It's also a great way to connect physician to physician, patient to patient, and bring the two together as well.
I think that stat that you mentioned that, physicians are spending like 8 minutes reading clinical notes, but then they spend 45 minutes on social. Like that's a huge gap. That's a huge difference. And I think as you mentioned, the profession becomes younger and younger. Everyone's going to be on TikTok and Instagram, and that's going to be part of sort of the culture. And, pharma brands have been a little hesitant to jump into social, but clearly there's such a huge opportunity there. What would you say they should keep in mind if they might be a little bit like risk averse about jumping into social, given all the compliance and regulatory stuff? Like how can they leverage that maybe in a sort of safe way?
Yeah. So, I think being hesitant, being risk adverse in this industry is par for the course. And we have to be, right? We have to be very careful. But I think that's why it's very important when you choose a partner for, developing your social campaigns or casting for your creators. You must choose a partner that has experience and that understands the complexities of the industry. It really doesn't have to be the scary space that it feels like it might be. When working with different creators, oftentimes I hear, oh, well, our legal team will never let us do it because everything has to be scripted and, we want it to feel authentic. Of course you do. You should want it to feel authentic. But just because you have to give in your brand guidelines doesn't mean it can't feel authentic. And for any client out there that thinks that the only way they can do creator is to let them go live and go rogue, that's simply not how it works, right? So everything that, we do at MR Media, and then I am, hopeful that other clients do as well, would be to have human and AI review of all content before it ever even goes to the brand teams to review and approve. So while social feels very live, it's not, right? It can be, but let's be honest, a lot of it's not. All of this content, all of these postings, they're being reviewed, they're being approved. So the content can still feel very authentic to that creator. And that is what we want, while also staying within those brand guidelines. Another thing is really important is to make sure that you are working with a partner that has adverse event monitoring. And what is that adverse event plan, right? So that can mean something like if you have comments turned on, which I do tend to recommend. It feels more authentic to have comments on, but they need to be monitored and they need to have an action plan for how they're handled if you do in fact have an adverse event. So what could that mean? An adverse event on social could mean somebody says something like, well, this product did not help me and my father still died of cancer. Okay, well, that's definitely a negative connotation, right? And we can't control what people are going to say. but we also need to be able to respond to how does the creator respond? How does the client want us to respond or handle that comment? Obviously, that person is never going to be happy, right? Their loved one has passed away. So we have to come to them with care and compassion in our response in order for us to take that kind of negative comment and turn it really into a positive. And this is where the brand can really make an impact. Hey, we are so sorry for the loss of your father. It doesn't mean that their brand didn't do its job or did do its job, right? It's coming to them with compassion. On the flip side, you also need to ensure that that adverse event monitoring is done by both AI and humans. And the reason is someone could say, my child would have died without this product. Now, if you only had AI monitoring, it would flag it for negative connotation immediately because the word death is in the sentence. However, this is not a negative connotation. This is a very positive connotation. And we want to make sure that that is absolutely left on the post, right? And so we have both AI and humans monitoring all of our posts. And again, it's having that action plan up front for exactly what you want to happen if there is an adverse event. 9 times into 10, there are not. But if there is, making sure you're working with a partner that has all of those plans in place ahead of the campaign going live really makes this a very safe and accessible medium.
Right. So they don't need to be shying away. They should be ready to dive in, but they kind of need to be able to balance this need for authenticity with making sure they have a plan in place and kind of this adverse monitoring that you mentioned. As brands are evaluating these different emerging channels and the opportunities there, how can they kind of like measure whether they're following a real audience shift versus simply chasing something new? Because I think, we obviously have these like major social media platforms currently, but there's always like new platforms coming out. There's new things constantly. It's a big fractured environment really, where there's like these new channels constantly appearing. So how can they be measuring that they're really following where the audience is going versus just kind of like something shiny and new?
Yeah. Well, I think the lovely thing about being in pharma is we often let many other industries take that leap first, right? And so when we work with clients, I often say, we stick with the tried and true, a Meta, for instance, for that initial campaign. And then we also look at what else is out there. We're evaluating across all platforms if they have the right audience to meet their needs, right? So it's a lot about if you think, okay, for instance, TikTok's very easy, right? So when TikTok came out, even 2 years ago, let's say, it was still very up in the air on, should we do TikTok or not? Well, now as it's evolved, we're able to see, there are physician creators on TikTok. TikTok themselves have started allowing more brands to come into that space in a very authentic feeling environment, right? So, one is, I don't ever think we should really just chase that shiny penny, but we have to look at the different platforms, like, as you said, that have the audiences we need. Part of that, again, I'm going to say working with a partner that understands the creators and the audience. Does it fit into what your need is, right? What are these audience of this creator? What are they doing? What are they engaging with? In my opinion, it is not how many followers you have. It is what the followers' engagement is. And so we look at our proprietary algorithm called FitScore to really understand, does this creator, does their audience meet the demands of the brand, right? So if you're working with a very rare brand, oftentimes they'll say, we can't do creator. There's just not that many people out there. Well, even if there's not that many people out there are people out there. We don't need 20 different creators. We might need one, and their audience might be small. But if you are suffering from an ultra rare disease, that one creator, that one patient can mean so much. And that content can mean so much to them and to their loved ones. So I really encourage brands I'm working on an ultra rare campaign right now, and I'm so excited because I really encourage brands to open up the idea of there are creators out there. They don't have to be and probably shouldn't be your KOLs. They really should look towards who is creating great digital content and what are they doing and how are their audiences engaging, because it really is an incredible way to reach even those very small patient and HCP audiences.
Yeah, I think that kind of resonates with, I actually was talking to a couple people about influencer marketing, and one of them mentioned this idea of fit over fame when choosing which influencer to partner with, and that it doesn't have to be the biggest celebrity with the biggest following. It's more important to find someone who can really like connect with a niche audience in a situation like a rare disease product, for example. And you mentioned some of the best practices for, partnering with influencers on social media, but what is like safe expansion across some of these other channels, like maybe CTV, and these other emerging channels like look like in practice? And are there any like best practices that marketers can kind of like implement as they kind of expand?
Yeah, I mean, I think CTV it's not really our new thing anymore, right? It is the thing. And, when we think about safe expansion, it's really just less about, in my mind, the actual safety of the medium, because we know CTV is safe and we know we can put guidelines in place for it. It's really about, again, that audience that you're looking to reach and ensuring you're reaching them when they're ready and in a moment of receptivity to take action, right? So it's really understanding what message is going to resonate with them. And so, if you're looking at HCP marketing across CTV, which we do all day long, of course, it's really understanding like, where should that be running? Is there audience fatigue? What is that message? Does the ad need to be 30 seconds, 60 seconds, 90 seconds? And is that going to make a difference? I love CTV when it's incorporated in the umbrella of the rest of a campaign, right? Because you really want to ensure that you are touching those physicians or those patients. You're really hitting them in all different kind of mediums to keep that awareness up. And sometimes, at night you're watching something and that awareness message is really impactful, right? Because your brain's kind of, like you said, in those blue jeans moments, those, white coats off moments, you're in that transition time. Your brain's a little more relaxed. You can really absorb what you're watching. And even in an ad, you can really absorb what it's saying and then take action. So what might that action be? You may use a QR code. You may just be directing them to their HCP or the patient site that you have, right? But it's that next step. What are they going to do next? And so that's why it's really important, if you're going to use CTV, that you're also using, display, that you're also incorporating social, that you're also incorporating, digital out of home and endemic sites, right? Because it's the consistency of seeing your message. I think the stat was like you had to see something 7 times. Probably has changed dramatically now, given that, we see millions of messages every day. But it was like you have to see something 7 times before it really resonates for you to take action. So if you run a CTV campaign in a silo, or you run a display campaign or programmatic campaign in a silo, your lift isn't going to be as great as if you're doing, a comprehensive plan together.
And as brands are testing these channels, what metrics should they be keeping an eye on that are kind of beyond the traditional performance metrics like click-through rate? What are the most important signs of success that they should be looking out for?
So that's a really great question because we get this a lot. So are we looking, I heard someone say like the other day, they were like, CTR isn't even a metric. I believe they said it someone said it at Transform at our breakfast, that CTR isn't even a metric that we care about anymore. Click-through is a click-through. So we have to think broader, right? So script lift is definitely something that's important to measure, but you also have to think of the medium that you're using, right? So is script lift going to be your ultimate KPI? Great. Park that there, but then look at the medium that you're using. So for digital out of home, for instance, for CTV, we have to get more comfortable with it being awareness. Like we're going to see the script lift in the end, but you're not going to see those traditional metrics, right? Like even if we're retargeting, we have to be comfortable with understanding like audience quality. We have to be comfortable with knowing that those kind of broader awareness plays, a sports play, digital out of home, CTV, may have that larger halo effect, right? Of drilling down to the tactical ways to drive even the click-through rate, but drive that next engagement, right? So I always say measure the standard metrics. I always think, if you can work in audience quality, or you can look at script lift, you can look at behavior change, right? So how long does it take a certain doctor to make that change? We look at our data a lot to see if you have a new drug that's coming out, and there's been kind of one key player in the space. Well, how are you looking and ranking those physicians, right? Like, oh, well, they're high prescribers. Yes, they might be high prescribers, but what are they doing of your competitor's drug now? But what are they doing with other drugs? What are they doing? How often are they willing to switch? How long does it take them to switch? Because to me, if you're looking to get patients on treatment as quickly as possible, you need to ensure that the physicians are willing to make a change, right? If they have a tried and true that they've used for a long time, then you really your messaging needs to be very educational for these doctors on why your brand is going to have better outcomes for their patients, right? Because if they are somebody that sticks to a very traditional path in terms of prescribing, we need to hit them with much different messaging than we do for the doctors that are more willing to change. We can look in their script, pattern behavior and see they're willing to try new things. And that's all something that comes in the strategy phase on the brand side, right? But can also be supported with data on your brand partner sides.
And my final question is kind of looking ahead to the future. I hear a lot that brands sort of need to better connect their HCP, DTC, and their broader brand efforts together into sort of a unified strategy. So how can they better do that?
Well, it is a great question, and it is one that I think we're all talking about and I hear all the time. And I think we can only do so much as partners as the client is willing to do themselves, right? So historically, a lot of our brand partners are still very siloed. I worked at a manufacturer. I was on the media buying side. I couldn't have told you at the time who my DTC partner was on my brands. I did all HCP. There's thousands and thousands of employees. I don't know. I think we're starting to see the evolution of that though, and they're coming together more because they do understand this is a broader conversation. But tactically, how can we connect it is where I think we look at the way we're messaging, the creative, and where we're messaging, right? So you might have a more clinically facing message for your HCP. Let's say it's a 30-second video. And your DTC is obviously far more patient focused or caregiver focused. But then you use those environments like a sports, like a social, maybe even CTV, where your message is a little bit more about the holistic picture of that particular drug or that particular manufacturer. I love what Lilly's doing recently of being, their message of being a medicine company, right? They're here to treat and support patients. They are a medicine company. That is very important, even when you get down to the brand level, because that doctor could be a patient and probably is a patient of something, right? But could be also a caregiver of a patient too. So even though that doctor thinks in their clinical brain and they're treating their patient with specific drugs, there could be another instance where that doctor was also thinking with their, white coat off, their consumer brain and their caregiver brain. And so those messages, those themes can really come together in kind of those bigger environments, right? And kind of blending the two so they feel very authentic to the brand, but they feel very holistic to both caregivers, consumers, and the physicians.
Yeah, I think that's going to become increasingly important, especially as we see like the line between HCPs and caregivers and patients blur even more. Because like going back to what we said at the beginning, like doctors are going home and they're scrolling on TikTok now and they're seeing the same things that consumers are seeing. There's, it's more of a unified, cultural moment for them, social media. So I think that's going to become even more important. Emily, thank you so much for joining.
We really appreciate it. Thank you.